show outward signs of disease.
Parts of their heads. And certainly there are many chickens that are infected that tend to die very quickly within 24 to 48 hours of infection. So clearly people should really avoid coming close or physically touching sick or dead poultry. People who work at poultry markets, people who raise chickens and ducks should definitely protect themselves if their poultry appear ill.
Regular cleaning and disinfecting of these markets, certainly disinfecting cages, cleaning cages. What Hong Kong has done is to segregate the types of birds.
Hi, I'm... That's much more. Think of it as a place to get insights from some of the world's leading thinkers on markets, industries, and the global economy. That's Exchanges at Goldman Sachs, available on iTunes, Stitcher, SoundCloud, and Google Play at gs.com/podcast. Hey, it's Chad Rod, host of Radio Lapse, first ever spin-off podcast, More Perfect, which takes you deep inside. It's pretty cool. Everybody is just quiet. And suddenly... And then... More Perfect from Radio Lab and WNYC Studios. Get it wherever you get your podcasts. Radio Lab. We're previewing first episode of More Perfect Season 2, so we go back to Fred Korematsu, who, as you just heard, lost his case before the Supreme Court, did not get the remedy he wanted, and so now he is, I don't know what he's going to do. Well, now he ends up getting a kind of remedy. You said it was...
each of the large-scale randomized trials comparing bivalirudin with heparin for myocardial infarction, including Validate Sweetheart, have agreed to combine the individual patient data from their studies into a single database. Detailed data from more than 36,000 patients randomly assigned to bivalirudin or heparin should provide robust evidence to guide decisions regarding anticoagulation among patients with STEMI and non-STEMI, according to various patient characteristics, procedures, and adjunct pharmacotherapies. Weight and metabolic outcomes 12 years after gastric bypass by Ted Adams from Intermountain Livewell Center, Salt Lake City, Utah. The authors report the 12-year follow-up results of an observational prospective study of Roux-en-Y gastric bypass that was conducted in the United States. A total of 1,156 patients with severe obesity comprised 3 groups: patients who sought and underwent Roux-en-Y gastric bypass, surgery group; patients who sought but did not undergo surgery, non-surgery group 1; and patients who did not seek surgery, non-surgery group 2. The follow-up rate exceeded 90% at 12 years. The adjusted mean change from baseline in body weight in the surgery group was minus 45 kilograms at 2 years, minus 36.3 kilograms at 6 years, and minus 35 kilograms at 12 years. The mean change at 12 years in non-surgery group 1 was minus 2.9 kilograms, and the mean change at 12 years in non-surgery group 2 was 0 kilograms. Among the patients in the surgery group who had type 2 diabetes at baseline, type 2 diabetes remitted in 75% of patients at 2 years, in 62% of patients at 6 years, and in 51% of patients at 12 years. The surgery group had higher remission rates and lower incidence rates of hypertension and dyslipidemia than did non-surgery group 1. This study showed long-term durability of weight loss and effective remission and prevention of type 2 diabetes, gestational duration, and spontaneous preterm birth by Ge Zhang from the Cincinnati Children's Hospital Medical Center, Ohio. Despite evidence that genetic factors contribute to the duration of gestation and the risk of preterm birth, robust associations with genetic variants have not been identified. This genome-wide association study in a discovery set of samples obtained from 43,568 women of European ancestry used gestational duration as a continuous trait and term or preterm, less than 37 weeks birth, as a dichotomous outcome. 3 Nordic data sets involving a total of 8,643 women were tested for replication. The investigators found that variants at the EBF1, EEF-SEC, AGTR2, WNT4, ADCY5, and RAP2C loci were associated with gestational duration, and variants at the EBF1, EEF-SEC, and AGTR2 loci with preterm birth. An analysis of mother-infant dyads suggested that these variants act at the level of the maternal genome. Previously, to affect 15 million Americans, approximately 4% of children and 1% of adults, and studies suggest an increased prevalence in the past 2 decades. Food allergy probably results from a breakdown of or a delay in the development of oral tolerance or a lack of clinical reactivity to a food substance in persons who are genetically and possibly environmentally predisposed to the development of atopic disease. 8 foods: milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish are the most common food allergens in the United States. Peanuts are the most common food allergen associated with fatal and near-fatal anaphylaxis. Obtaining an appropriate medical history and collaborating with an allergist to interpret the results of clinical tests are important for the diagnosis and management of food allergy. Medical management currently focuses on the following: recognition of signs and symptoms of anaphylaxis, ready availability of an epinephrine autoinjector with early use when signs or symptoms of anaphylaxis are present, followed by immediate evaluation in an emergency facility for monitoring after use, strict avoidance of culprit food allergens, and education about safe food products. Early introduction of peanuts in the first year of life in many children reduces the risk of peanut allergy considerably. Thrombophilia testing and venous thrombosis, a review article by Jean Connors from Brigham and Women's Hospital, Boston. Ordering thrombophilia tests is easy. Determining whom to test and how to use the results is not. Although inherited and acquired thrombophilias are acknowledged to increase the risk of venous thromboembolism, VTE, the majority of patients with VTE should not be tested for thrombophilia.
Data showing the clinical usefulness and benefits of testing are limited or non-existent, as are data supporting the benefit of primary or secondary VTE prophylaxis based on thrombophilia status alone. Testing for inherited thrombophilia is controversial, with some arguing that these tests should never be performed. Patients with inherited thrombophilia can often be identified by coagulation experts on the basis of the patient's personal and family history of VTE, even without knowledge of test results. The risk of VTE increases with age, starting in the late 40s, with a dramatic increase occurring at 60 years of age. Therefore, patients in whom VTE develops at a young age are more likely to have an inherited thrombophilia. Results of thrombophilia testing should rarely affect clinical decisions about the treatment of VTE. Risk stratification tools have been developed to aid in assessing the risk of recurrence in patients with unprovoked events. Thrombophilia status is not incorporated into any of these tools. A patient with an acute VTE requires full-intensity anticoagulant therapy, regardless of the cause of the VTE. A 59-year-old woman with pain and swelling in the right hand and ankles. A case record of the Massachusetts General Hospital by Lee Hart and colleagues. A 59-year-old woman presented with the sudden onset of erythema, pain, and swelling in the metacarpophalangeal joint of the right thumb, with no associated symptoms or preceding illnesses. 9 days earlier, stiffness, swelling, and pain developed in the metacarpophalangeal joint of the right thumb that limited her ability to perform tasks such as dressing. The stiffness did not improve throughout the day. Pain, warmth, and swelling developed in both ankles and progressed despite empirical treatment with glucocorticoids. Examination revealed effusion of both ankle joints and pain with movement of the ankles and the metacarpophalangeal joint of the right thumb. A key consideration in this case is the apparent involvement of multiple joints, which may suggest a systemic infection with hematogenous spread to the affected joints. Septic arthritis due to bacterial infection is most commonly caused by gram-positive organisms. Could this patient have disseminated gonococcal infection? This infection can cause either purulent arthritis or a combination of rash, tenosynovitis, and migratory arthralgias. Although this patient is not in a high-risk age group for gonococcal infection, she had unprotected sexual intercourse with her male partner 2 weeks before her presentation, which fits with the expected time course of disease onset in a person with disseminated gonococcal infection. Tuberculosis elimination in the United States. The need for renewed action. A perspective article by Ronald Bayer from Columbia University, New York. Tuberculosis continues to kill 1.8 million people globally each year. In 2014, the World Health Assembly embraced an ambitious resolution to reduce deaths from tuberculosis by 95% by 2035. But tuberculosis has all but vanished from the U.S. public's mind as a perceived threat, which jeopardizes the prospect of tuberculosis elimination in the United States. Critical ethical and policy questions must be addressed if elimination is to be pursued in earnest. The challenges are very different from those involved in responding to infectious tuberculosis disease, when the threat to people who are sick and others around them is immediate. There will be legitimate concerns that screening programs targeted at people with the highest risk of latent infection will inadvertently stigmatize or unfairly burden immigrant populations and will fuel xenophobic sentiments. Although these potential harms must be addressed, they do not justify failing to act effectively to realize the population-level promise of elimination. In a landmark report published by the Institute of Medicine in 2000, the IOM committee proposed that immigrants applying to enter the United States who are found to have latent tuberculosis infection be permitted entry under the condition that they undergo therapy, and that inmates also be screened and treated for latent tuberculosis infection. But the kinds of public health campaigns envisioned by the IOM committee were never implemented. A nicotine-focused framework for public health, a perspective article by Scott Gottlieb from the Food and Drug Administration, Silver Spring, Maryland. Despite extraordinary progress in tobacco control and prevention, tobacco use remains the leading cause of preventable disease and death in the United States. Combustible cigarettes cause the overwhelming majority of tobacco-related disease. Indeed, when used as intended, combustible cigarettes kill half of all long-term users. The FDA's new tobacco strategy aims to reduce the addictiveness of combustible cigarettes while recognizing and clarifying the role that potentially less harmful tobacco products could play in improving public health. The regulatory framework for reducing harm from tobacco must include nicotine, the chemical responsible for addiction to tobacco products, as a centerpiece. Nicotine, though not benign, is not directly responsible for the tobacco-caused cancer, lung disease, and heart disease that kill hundreds of thousands of Americans each year. The FDA's approach to reducing the devastating toll of tobacco use must be rooted in this foundational.
Nicotine is, however, responsible for getting smokers addicted to cigarette smoking in the first place and keeping them addicted long term. The public health benefits of implementing a nicotine reduction policy for combustible cigarettes could be enormous. The fate of FDA post-approval studies, a perspective article by Stephen Wallachan from the Dartmouth Institute for Health Policy and Clinical Practice, Lebanon, New Hampshire. The Food and Drug Administration often requires post-approval studies to address issues such as optimal dosing, potential long-term side effects, and use in children, or to confirm a drug's clinical benefit. Congress included in the FDA Amendments Act of 2007 additional power for the FDA to require companies to complete such studies. These authors assessed the effects of the 2007 legislation using the latest Federal Register status report to evaluate 614 post-approval requirements and commitments imposed in 2009 and 2010, the earliest years covered by the report. After 5 to 6 years, 20% of post-approval studies had not been started, 25% were delayed or ongoing, and 54% had been completed. The slow, irregular pace of post-approval studies contrasts starkly with the short, rigid deadlines and other shortcuts used to speed marketing approval. The FDA's approach to post-approval studies has improved over the past decade, but additional work needs to be done. First, the FDA could do more to ensure that sponsors meet post-approval deadlines. Second, although the FDA is under pressure from Congress to reduce the number of unfulfilled post-approval requirements, it should be very careful about freeing sponsors from the obligation to conduct previously required studies. Finally, these authors believe the FDA should consider setting shorter completion deadlines. Our Images in Clinical Medicine features a 54-year-old woman who presented to a dental clinic with a 1-year history of oral swelling and a sore mouth. She had regularly chewed loose leaf tobacco, which she had placed on the floor of her mouth between the jaw and tongue up to 5 times each day for more than 10 years. Intraoral examination revealed an irregular indurated lesion that measured 3 centimeters in its greatest dimension and was located on the floor of the mouth inside the left jaw. Incisional biopsy of the lesion revealed invasive squamous cell carcinoma with hyperchromic pleomorphic cells and a keratin pearl in the connective tissue. CT and PET showed no bony or lymph node involvement. Squamous cell carcinoma is the most common type of neoplasm of the oral cavity. The patient underwent an en-bloc excision of the carcinoma as well as segmental mandibulectomy with the use of a vascularized free fibular flap as an osteocutaneous graft and selective neck dissection. Pathological analysis revealed no involvement of bone or lymph nodes with tumor-free margins. The patient was advised to stop using tobacco products. 2 years after treatment, she remained free of recurrence. A 17-year-old boy from a rural town in Mexico presented to the hospital with a 3-week history of decreased visual acuity and pain in the right eye. He could see only hand motions. Intraocular pressure in the right eye was elevated at 30 millimeters of mercury. Slit lamp examination of the right eye revealed corneal edema, blood in the anterior chamber, multiple iris perforations, and an inflammatory pupillary membrane with zones of retinal ischemia on the posterior segment. During the examination, a flattened and mobile trematode was seen moving freely in the anterior chamber, migrating through the iris perforations from the anterior chamber to the posterior chamber of the eye. See the video at nejm.org. The patient reported no relevant food exposures, history of swimming in lakes, or other water exposure. The patient received oral treatment with praziquantel and underwent lensectomy and vitrectomy to surgically remove the trematode. Extensive damage to the retina and iris was found during the procedure. The trematode was removed in multiple pieces and could not be more specifically identified. After 6 months of follow-up, the patient had no improvement in visual acuity in the right eye. This concludes the summary of the September 21st issue of the New England Journal of Medicine. We are interested in your feedback about our audio summaries. Any comments or suggestions may be sent to audio@nejm.org. Thank you for listening. Welcome. This is the New England Journal of Medicine. I'm Dr. Michael Beerer. This week, September 28, 2017, we feature articles on anacetrapib in atherosclerotic vascular disease, exenatide and cardiovascular outcomes in diabetes, oxygen in suspected acute myocardial infarction, rituximab after transplantation in mantle cell lymphoma, investing in global health for our future, and the Lasker Award for mTOR discovery. A review article on red cell transfusion, a case report of a woman with altered mental status and acute liver failure, and perspective articles on the limits of the human mind, on the paradox of coding, and on ancillary care and study endpoints. Visit nejm.org to participate in a